Thanks for coming. It's my pleasure today to introduce to you our speaker, Dr. David Berger. He is a board-certified pediatrician at Wholistic Pediatrics and Family Care and the founder of the Family Medical Cannabis Clinic. So, Dr. Berger.
Hello, everybody. Well, it's a pleasure to be here. Can everybody hear me all right? Okay, I can do without microphone. Awesome. You know, it was interesting that one of the first speaking about this topic that I was asked was at a baby expo, which I thought was kind of an interesting thing because, you know, so to dispel myths, I'm not encouraging that we give cannabis to babies. You know, I don't know if we'll be there at any point in our lives, although one can make an argument that the non-euphoric strains, maybe there'll be some cases where that will be helpful, but obviously we won't be talking about giving marijuana to babies today. Right. So I would like to kind of give you a little bit of a backstory as to kind of how I got into this in the first place. Back in college, actually, the very first paper that we were asked to write in our English class was to write a letter to a senator, governor, or some authoritative figure advocating a controversial position that you could take a stand on. And we were supposed to have a 2 to 3 page paper, just kind of an introductory thing. And I decided that I would write a letter to my senator explaining why I thought that cannabis should be something legal, available to people, both on a medicinal as well as a recreational purpose. And I wanted to investigate about everything from what one could accomplish through taxation, through purity of products, to decreasing the crime rates, making varieties available to people. And what was supposed to be a 3-page paper ended up being an 11-page paper because of the just sheer enormous amount of wonderful information. I mean, every single sentence was documented up the wazoo. And it really kind of opened my eyes because, you know, when you're coming out of high school, you kind of hear about things recreationally, but you don't really think about how could this actually fund governments and actually keep people out of jail and all those types of things. So that was kind of like a really early opening to me. We can fast forward a little bit to when I did my pediatric residency at USF at Tampa General. And I've always been more the type of person, this is probably one of the few times you'll see me actually wearing a tie, unless I'm at a wedding or bar mitzvah giving a talk, but I'm more likely to be hanging out at Skipper's than to be hanging out on the golf course with anybody. Hi! And so while I was at USF, I started having friends asking me about a variety of natural products and using of herbs and probiotics, and at the time I kind of felt that as a pediatrician, it was really my responsibility to know about anything that people could be giving to children, you know, and that it shouldn't just be kept to pharmacological agents, because if parents are asking, we should have an answer for them and not just blow them off. And I was also incredibly fortunate in that the Dr. Lou Barnes, who started USF Pediatrics, was really considered the preeminent godfather of the progressive pediatric movement. He was advocating for breastfeeding before women realized they had breasts, almost. Like, I mean, in terms of in American politics, in America, you know, when doctors were telling people that formula was no different and or there was no advantage to breast milk. And he was also really into B vitamin metabolism. He was really into avoiding antibiotics except for in really terrible situations, and would come into clinics and give us handouts about kids having side effects to this cough medicine and to that antihistamine, and why does Benadryl have, as an allergy medicine, have red dyes in it in the first place, unless you get the dye-free version. And so, and as well as just, again, a huge advocate for breastfeeding. And thankfully, he was who I fell into as my mentor, because we just kind of got assigned that way and said how it happened. And so I really kind of became empowered to start looking in these directions. And then halfway through my residency, an article came out in our pediatric trade journal called 7 Herbs Every Pediatrician Should Know About. This is not one of those herbs. We'll get to that part in a second. But it talked about things like echinacea and chamomile and ginseng and ginger and mahuang. And I went to the director of the USF Pediatrics and I said, you know, am I allowed to start using these things in clinic? And Dr. Barnes was actually the person who founded that magazine, actually, and was still like an editor-in-chief. And so I was told, well, if it's in contemporary pediatrics, you could do whatever you want. And so I started using herbs and supplements in the clinic down on 17 Davis Island, and a practice which is usually, usually with the medical school clinics are usually serving underserved populations, Medicaid populations, and we started noticing that over about 6 months, like all people started showing up who would have normally weren't showing up to the clinics because of what I was doing. So, and usually like when people would come, if they weren't part of one of the underserved populations, they would want to see the attending physicians, the professors, and like here they were making appointments to see me as the lowly resident, but yet I was all of a sudden like starting to see all these insurance pay people, which of course helps the department out because they make a lot more money that way. And so I left Tampa General at 1997, so I've been a pediatrician for 20 years now, which is kind of a mind-blowing concept in the first place. And I joined a practice where I started doing some of these things, and one of their policies at that practice was that you couldn't walk in the door if you weren't vaccinating your children. And I just kind of felt, I take a very libertarian approach to healthcare and to wellness, and believe that a parent has the right to make a decision however they wish to treat their child or not treat their child, regardless of what it is, and that it should be our job to help them figure out what information they have is legitimate. I mean, sometimes people will bring me a book about vaccines like from the 1970s. I'm like, we don't even give any of those vaccines anymore. So I mean, I want to educate you on what you're doing so that you can make the right decision. Well, after a while, they caught wind of what I was doing. I got booted after 10 months. And then I was actually asked to join another practice that was actually the only one in town that was allowing people to come into the doors if they weren't vaccinated. And the doctors, they did that begrudgingly, but they at least believed in a parent's right to make that decision, and so they were very happy to kind of farm every one of those patients. I pretty much became the pediatrician of every chiropractor kid in town, and then but at the same time, I started learning about herbs, and really things started to explode. Started working with children with autism. I've now seen probably about 2,000 children on the autism and neurodevelopmental spectrum, taking a nutritional and biomedical and detoxification approach to them. But I'm also a pediatrician who sees kids for checkups, and I do a lot of lactational support. I'm on staff at Labor Love Birthing Center, and I help teach the birthing classes over there. And we've actually, and over time, then parents started asking me, well, we can't really find a doctor who will take care of us the way you take care of our kids. Will you be our doctor? And for a while, I'm like, but I'm a pediatrician. Really? You want that? But they kept on asking, and I kind of felt, well, again, keeping to my original philosophy that a parent or a patient should have the right to make a decision who and how they receive health care from. If there was nobody else in town who was going to fill that void, then I did. But I always told them, but, again, realistically, especially with younger parents, I mean, is there that much of a difference between a 30-year-old and an 18-year-old at that point? Probably not. And then all of a sudden, the grandparents started asking, and I'm like, here we go. And that was really fascinating, but I always told them, but as long as you're okay that at any point if you ask me a question, I'm allowed to pull my pediatrician card out and say, I don't know what you're talking about, or let's find an answer for you. So that's how I kind of started taking care of adults, and now in my practice at Wholistic Pediatrics and Family Care, about 20% of my practice is adults, and I now have an adult or family medicine nurse practitioner who takes care of the more complicated patients, and I now have a pediatric nurse practitioner who's been helping me out. So fast forward now to approximately 2014, which is where this kind of conversation begins. So in 2014, which was around the time when the first attempt to pass the Constitution for medical cannabis when that had failed, but as an aftermath of that, when I think that the legislators saw the writing on the wall, since that barely didn't pass, and they decided to put their fingers into this one and made a system which I guess you could say is better than nothing, but it was a really restrictive system, and the number of hoops that they were asking people to jump through in order to accomplish this was rather monumental, and the fact that they actually took 2 years to actually get a product on the market in the first place with that, because of all the restrictions that they put on all of the dispensaries, which is what they're referring to. So you'll heard the term dispensary, like if you drive down Dale Mabry, you see Trulieve down the street there. But a dispensary is actually somebody, in the law as it stands right now, is that you have to be the person who puts the seed in the ground, cultivates it, separates it, tests it, purifies it, bottles it, sells it, and securities and everything else. And they made it so that you had to be a grower in the state of Florida for at least 30 years in order to get that blessing in the first place, which really kind of made it into kind of an old white boys club and kind of made it into a very restrictive and a lot of who your friends are type of thing. And it really kind of became not quite a monopoly, but a oligarchy. Is that the oligopoly? And that's kind of where we're standing right now. And even right now, which we'll talk more in a little bit about what's happening going forward. But right now, they're having difficulty keeping products on there. They're having problems with their grow, which you would think, don't you just plant a weed in the ground and it should grow, but not quite. And and even like, oh, well, they've been doing this in Colorado. Well, the humidity is a lot different here. The earth itself is different here, so it takes some time to know what you're going to how to do this. I understand that one of the dispensaries just pretty much had to destroy their entire crop because something came up. I just found out about this last night, so I didn't find out what the details were, so they have to start over. And so there are a couple of things before we talk about the law and how things have moved forward since then, though, that I want to kind of talk about, because I do believe that there are a lot of misunderstandings and myths about this particular herbal treatment, this medicine in the first place, okay? You'll hear about things about, oh, but this is a gateway drug, and the reason why why the people were trying to keep this is because it's going to move them into other types of harder drugs, of which there's really no evidence whatsoever that that's true. Alcohol is much more of a gateway drug to harder things than marijuana is, in all honesty, and cannabis is. People talk about addictions. There is no physical addictiveness to cannabis. Yes, we do have natural cannabinoid receptors in our brains, and yes, our body actually has what's referred to as the endocannabinoid system. We actually do make some cannabinoids, not nearly the potency of what we're talk about in a few minutes, but we naturally make some cannabinoids, and we have receptors in our brain, of which I think some people would then say, well, if we have receptors in our brain, why are they there if they're not to be utilized? But there is not a physical dependence. Now, people say, oh, but there's a psychological dependence. Well, what's your definition of dependence? Because if that's the case, I mean, there's probably a lot of people who are physically dependent on Prozac, or a lot of other things that are out there that are on the street for that. Ritalin, isn't the definition of dependence that you are functioning because of it, or if you take it away that you're not going to do well? Well, I think that any psychiatric drug that's on the market right now, pain medications, people, I'm not even talking about the OxyContins, but people who have chronic headaches and who have to take different types of medicines for that. Well, I guess you are dependent on it because if you're going to feel lousy if you don't take it, okay? But I mean, is that any different from here? And I don't think it really is. There's concerns about redistribution. That's one of the things I hear. Oh, that people are going to get this product and then they're going to go ahead and sell it somewhere else or give it to somewhere else. And first of all, if you look at what the prices are of the products that right now, if you really were into that and you were getting it beforehand, you're not going to spend all this money to see doctors and to go get it there relative to what people are getting it on the street. I mean, yes, there is a purity aspect of things, and there's a legal concern, which of course that's very real. But I don't really see people putting lots and lots of monies into something that's kind of readily available right now, and they probably know who they're getting it from in the first place. So I just don't buy into the whole redistribution aspect. In fact, one of the things that they're trying to stop and prohibit is us using telemedicine. In my practice, I use a lot of video conferencing. And it's one thing if you're wheezing, unless you have a Bluetooth stethoscope, I can't listen to your breathing. But if the question for you is how many seizures have you had this month versus how many seizures before you started using treatment, or how's your anxiety, or how's your depression, or how's your arthritis, that's not something that I'm going to learn about on face-to-face with you, as opposed to with my hands on laying hands on, relative to me asking the questions. And in fact, in the state of Florida last year, they did actually change the overall scope of telemedicine to say that telemedicine, even to start the doctor-patient relationship, is fine as long as the quality of care is not compromised by you not laying hands on them. But then they're now trying to make a carve-out for this particular treatment, which is a legal treatment in the state of Florida. So that to me is very bothersome that they're willing to do that. And and they actually are using the question of redistribution as part of this. And I'm thinking to myself, whether somebody comes to my office and I put hands on them and then they go to the dispensary and get it, or I'm seeing them via telemedicine and then they go to the dispensary and get it, How is it any more redistribution happening there, especially because of the fact that we have to specify how many milligrams of cannabinoids, how they're going to take it, and they're only allowed to get it for 45 days at a time. So I mean, you're not going out on a drug dealer binge going to do that if that's how you're trying to get your product. So it doesn't make sense on many different levels, but the law is the law. And although I've been one through the years to, of course, test boundaries, I never cross them. And once we are, when there's a law there, we know that there are certain things we can and can't do. And I'm going to go into a lot of what those are because, thankfully now, especially with our electronic charting system, the questions and the way we process through the process, I mean, if you are doing this on paper or trying to figure it out, it is a very laborious process. But thankfully, we've streamlined it electronically, so it's not nearly as rough as it was when we first sat down and said, you want us to do all of these for that? But again, it's the law, so we have to do it. So in 2014 is when the original compassionate use law was passed. And that allowed for the non-euphoric strains of cannabis. So CBD, which is the non-euphoric main component, THC is the euphoric component. People hear about Charlotte's Web. That's kind of like the one that a lot of people have heard about, that they're using a lot of kids with seizures on. You cannot, there's no euphoria. You don't get high from it. The paranoia, you cannot, it's as safe as vitamin C from everything that I've seen, except for too much vitamin C, you can get diarrhea. But I don't think you can even get that from this. Maybe it's safer than vitamin C. But that was what was allowed originally. Now, it did take 2 years from when they passed that law to actually have product available. So, but the physicians have to take an 8-hour medical education course just to be certified to write this, which, of course, I did. But it's kind of ridiculous because, you don't have to do that for OxyContin or Ritalin. I mean, you just have to have a medical license. But they've carved this. So again, of course, we're going to do that because that's what the law says. But that doesn't happen for any other controlled substance, but we had to do that. So, and I do believe that this may be in part to try to keep the things restricted that people don't bother, or doctors are afraid to, or doctors don't want. And I had to spend $1,000 to take the course in the first place, which again, that doesn't happen for any of those other medications. But at the time, we were allowed to order the non-euphoric strains for people with chronic seizures, for people with chronic muscle spasms, regardless of the diagnosis, and people with cancer. Then in 2016, the legislation added people who were terminal. Okay, it didn't matter what was terminal. If you're specialist, so it wasn't me as the primary care doctor who deemed somebody terminal. If your specialist put on the piece of paper that you were terminal, that you were then allowed to, and you were allowed to get for the first time THC, so the euphoric forms, because they figured, I guess they were compassionate enough to say, hey, if you're dying, let them die in peace. Which, let's face it, compared to how they drug people up, and they, and because of either the pains they have or they're so snowed that they're not even recognizing your family members, let's face it, that's never going to happen to somebody using cannabis. So, and so that did change, and then, but a bunch of other things were put into play with this compassionate use law. One thing, which of course makes sense, is that the doctor has to assess the potential benefits relative to the potential risks. Now, one of the things that's not currently allowed is that there are no smokables. There are no buds, okay? So, which I actually think I'm okay with that because nobody really should be smoking anything. As a physician, I don't believe. Now that we have things like e-cigarettes, which is one of the things that's available, if one wants to do an inhaled form to get the quicker acting, because when you take something by mouth, it's going to take a lot longer to kick in. And it affects the body differently. When you swallow something, a percentage gets broken down by the liver before it gets to your brain, unless you do it under your tongue. Some people don't like the tongue. But as of right now, there are no other edibles. There's no baked goods. There's no gummies or sucker candies or like there is in a lot of other states. But, if you have a kid who won't sit, you can't expect, can I really expect a 7-year-old who's having seizures to sit there and inhale off of an e-cigarette? I don't know that I want to have them associate with that movement in the first place. But realistically speaking, I don't know if you can really teach some. I guess you could, but that's, is that what we want to be teaching our kids? Again, if that's the only thing that will work, by all means, I will do that. But, but also, and, that, even when they're making in other states where they make gummies, and it has been an issue where kids have gotten a hold of something that they thought was candy and didn't realize that this was in there, and they've kind of gotten into some issues. But there are other ways of accomplishing such as like, which is actually kind of funny because what the Florida Sheriff's Association, even though they were against Amendment 2, I'll fast forward and come back when the Department of Health did its touring listening tour, as they kind of referred to it, the workshops back in February. The head of the Sheriff's Association stood up and said, while we were opposed to Amendment 2, we realize it's the law and we are absolutely going to, we're asking for two things. Don't put food coloring into any edibles, which I was like, great, because in my holistic practice, I don't want food colorings going into anybody for any reason. So, will a gray-looking gummy not be as attractive to somebody as the one that has red dye number 40 in it? Well, probably, and that's okay. Okay, and then the other thing that they said is we're asking for you to put pictures on the ID cards, because if we pull somebody over or stop somebody, we don't want to have to go back to the car and have to look up to see if you are who you are. If we look and we see that your picture's on that car, we say, have a nice day. If that was the only two things that the Sheriff's Association had to be about where we are right now, I think we're in a pretty good place. So, we have the physician, and it's physicians only, DOs and MDs, no other provider, nurse practitioners, PAs are allowed to do it right now. So we have the physician and the patient have to discuss the benefits versus risks. In reality, if you're not smoking something, the risk is kind of sort of low, with this particular treatment. There has to be informed consent, but that's kind of true for any treatment. If there's a minor, anybody that's under 18, there has to be a second physician who's certified, a licensed physician. Doesn't have to be a cannabis certified physician who just has to make a statement that says that the benefits outweigh the risks for this individual. We actually have a second physician on staff who's able to provide that for the patients with a chart review. So we offer that. And then as far as I said, the different treatment options are basically, again, inhaled forms, in the vaporizer form, capsules, and liquid drops. Now, once a person has, and then the other thing, which is another incredibly frustrating thing about the current law, is that the patient has to be seen by that doctor for 90 days before they can start treatment. Which, I mean, imagine if you found out that your mom found out that you had cancer next week, and you're supposed to start chemo the next week after. And then all of a sudden, like, okay, great, you can start cannabis in 90 days. Well, I mean, that's cruel. I mean, that is one of the most disgusting things I think about this law. Because with all these other hoops that they're asking, I haven't even told you all the other hoops yet, that they're asking people to go to, it's not as if this is going to be a willy-nilly type of thing. But that's how it is right now, is that they have to be a patient for 90 days. So, I mean, I've families with a kid with new onset seizures. And the parents like, I've heard about all these seizure medications that often don't work, and they're really hard on the liver and really toxic to some people. One called Lamictal, they break out into the rash. It can be a fatal situation quickly. I don't want to put my kid on that. I'd rather try cannabis first. Well, okay, sure, wait 90 days. I mean, it's just a terrible situation. And there are now, and we'll talk a little bit more about the legislative front, but there is a movement to try to do away with the 90 days, which I will ask all of you to write to your congressmen and senators in the state of Florida to advocate for that, because that to me is by far and away the most insulting and terrible part about the way that the current law is. If a doctor and a patient makes that decision, I mean, imagine that with anything else, you broke your leg and you need OxyContin. Okay, I mean, I've never ordered OxyContin for anybody in my life, but I'm at the doctor say, oh, I'm sorry that your leg is broken. In 90 days, come to me and I'll give you some OxyContin. I mean, come on, I mean, it's ridiculous. So once we have seen a patient for 90 days, in our practice, we actually will see the patient and about 2 weeks before the 90 days are over. So that way, if there's any last minute things, one of the things that I ask in my practice is, unless you've been a patient of mine long term and I've been seeing you throughout this, if anybody comes to me, for instance, and they say, well, I have a condition here, the way that I'm kind of covering myself is saying, great, no, not great, you have the decision, but great that you're here, that I can help you, but I want to see another medical professional or mental health care professional's note that just says that you have that condition. Because obviously anybody can walk into the office and say, I have anxiety, okay? Not putting recreational aside and what the benefits may be for people, we'll put that aside for now. But from a purely medical perspective, if I have a psychiatrist, psychologist, or other mental health care worker that says, I've been seeing this patient for this period of time, well then obviously, and then for anxiety or whatever the diagnosis is, or this person has multiple sclerosis and needs to go to physical therapy, well, if I have the physical therapist note that they're going, then obviously that's an issue. So we're going to get a little bit more in a second. But once I've seen the patient for, have they been at least for 90 days, then we get to, when they come back, we discuss the different treatment options. Some people want one form, some people want the other. And then we put a plan together, and I give them a very specific how they increase the doses gradually and how they can interact with each other. I also do drug interaction checkers because a lot of people that I see are on medications already, and just like with any other medication, you want to make sure that one drug's not going to interfere, either speed up or slow down that drug. But we have a nice database so we can check that all out. And then we finally enter the patient into the compassionate use registry. This is something that's been established by the Board of Health, where we put in the number of milligrams that they're allowed per day, which route of administration, and for up to 45 days. Once that is done, then as soon as we hit send, the patient is then allowed to actually apply online for the compassionate use ID card. Now, as part of that, they have to take a picture, which now there's phone apps for that, so at least you don't have to go to the Walgreens or to the DMV to get a picture taken for you. And then the interesting thing is because cannabis is not legal on a federal level, right now, the banks are not allowing people to store their money or to even run credit cards. Our credit card company actually pulled the plug on us because we were called Medical Cannabis Clinic, even though we just do consultations. We don't distribute it. We don't have any product on board. And so, so now, right now you actually have to mail, even though you fill out the application online for the state of Florida, you actually have to then mail in a check or a money order for $75. But at least when they get that, then they actually immediately send the patients a temporary ID card where they can go with their ID number or call the dispensary. They pull it up and they say, oh, I see Dr. Berger has ordered 50 milligrams 3 times a day. How much of it do you want? And then anywhere in the state of Florida, there's actually home delivery now where people can get it up to 3 times a week. There are deliveries throughout the state, or they can go to one of the dispensaries. I'll come back again to that as well. Once they're put into the compassionate use registry, every 45 days we have to put up a new order for them. And when they first get put into the registry, we also have to submit a treatment plan to the University of Florida College of Pharmacology database, who is doing this to supposedly research it. I say supposedly because, unfortunately, if you look at the questions that they're asking, it is garbage data that they're collecting. I mean, literally, no matter what the condition is, on a scale of 1 to 5, are you the same, somewhat better, a lot better, somewhat better, a lot worse? I'm like, well, what if a person's having seizures and anxiety? How are you supposed to answer that question with, well, maybe my seizures are worse, but my anxiety is better? There's no other way of asking the question. So hopefully they're going to realize that what they're collecting is, we do it. We have to submit the information. We ask the questions all the time. But there's nothing researchable that they're going to get out of this, which is a shame because we need research on this stuff. But it's just, I don't see how they're going to possibly be able to do anything that would be publishable in an actual medical journal based upon the questions that they're asking. But we have to do that. So now, 2016, one of the things that they did change before we all voted for this, or most of us voted for this, is when they brought in the fact that terminal patients were allowed to be used, as I mentioned. So now comes Amendment 2, okay? And as you are aware, Amendment 2 passed overwhelmingly in the state of Florida. 71% of people voted for this. I realized that, 71%, there's probably nothing more as popular besides puppy dogs and Santa Claus. The reality is, who gets 71% let's face it, we have a pretty diversified electorate in our state. You don't get 71% approval on anything. So the fact that 71% of people voted for this is actually a pretty monumental thing. And it got the legislators it got their attention. Even the very conservative naysayers, it got their attention. And they realized, okay, even my most hardcore conservative constituents want this. The most conservative county in the state of Florida still voted for it at 60%. So, and in Broward, I believe it was over 80%. So that kind of, so there was some writing on the law that they realized that this was there. And that obviously, the fact that it didn't just pass at 61% because they needed 60% to pass, that's a tremendously huge number there. And I think that's given a lot of us more comfort in recognizing that we're on the right path and, we're on the right with all of this. So Amendment 2, as you are probably aware, there was a list of diagnoses that were allowed. HIV/AIDS, Parkinson's, glaucoma, Lou Gehrig's disease, cancer, PTSD, multiple sclerosis, see if I missed any, and Crohn's disease. And then, but if you remember, there was this last one that said other similarly debilitating conditions of kind or class. which of course made for a very interesting interpretation. And realistically, how I'm basing my practice. Because then the question would be, what is considered a debilitating condition in the first place? Well, to me, a debilitating condition, if there's either your condition is affecting your life in a negative day-to-day basis, or you're having to do some type of either pharmacological or talk therapy on a regular basis to get you through it, whether it's affecting your ability to function at work, your family relationships, your ability to get out of bed. If you have problems, you have it's a debilitating condition to you. Okay? So then we said, well, how is it a similarly debilitating condition? And then I said to myself, well, what are the debilitating conditions of PTSD? Insomnia, anxiety, panic attacks. Okay, what are the debilitating conditions of MS? Neuropathic pain, myopathic pain, chronic headaches, muscle movement disorders, muscle spasms. What are the chronic debilitating of Parkinson's, shakes, inability to speak when it gets advanced, which I kind of said, well, I have a lot of children with autism who have an inability to speak, and nobody can tell me that Parkinson's is more debilitating than autism in terms of their ability to speak. Okay, and then as I went through all of those Crohn's disease, okay, whether you have Crohn's disease, ulcerative colitis, diverticulitis, or whatever, if you have a debilitating abdominal symptom that you're curled up in bed sometimes, or you're having chronic bloody diarrhea, or you can't keep food down, or you have no appetite, you're debilitated whether you have the label of Crohn's disease or not. So I then came to the realization when I looked at the diagnoses that are there, that almost every debilitating condition known to mankind would be found as a symptom that's debilitating to one of those conditions. The only one I have not been able to find a good match for is ADD. Okay, I'm a creative guy, maybe I'll find one event, but I've not been able to find one, although a lot of my ADD kids have anxiety or some other type of other thing going on, or tic or something like that I will use for that. But straight up regular ADD is the only one that I've not been able to find. So then the question becomes, is it debilitating? Well, you know, I guess if I can use the Ritalin as the example, well, if you're having to take Ritalin on a daily basis, otherwise you're not going to succeed in school, you're debilitated. So that's the way that I'm interpreting that, and that's how I've been able to approach this. And I've had 3 different legal teams verify that I read the law right, and they're like, that's exactly what the law says. I mean, we're not even trying to be creative and fill in blanks. That's exactly what the law says. So that's kind of where we're at right now. Okay, the number of products are starting to diversify. We are still very limited with the number of strains of cannabis that are out there. Most dispensaries only are doing 1 or 2. If you went out to Colorado, 10 minutes total? Okay, when we go out to, if you ever go out to Colorado, you will see jars and jars and jars of products there. But we still don't have actual live buds, but they actually just started coming up with, because the law says no whole buds or whole plants allowed. So they said, well, what if we ground it up? And that didn't say you can't grind it up. So what they're actually doing now, there's one of the dispensaries, it's almost like a K-cup, where they are, it's like a vaporizer that you kind of like slide the little cup in that has the precise amount in there, and you're vaporizing that. So you're still not allowed to smoke it, but now for people who are wanting to get the benefits of the whole herb, they're allowed to do that through this types of thing. Now, where things are going to be going forward is very interesting, okay? Because right now there are 6 bills. The Florida session has just started. There is one called the Brandis bill. I encourage you guys, because there's devil in these details that could end up leading with a really, really awesome law, or there's some of the bills that are out there will actually be a step backwards from where we are right now. So the Brandis bill would be kind of like our utopia law. I mean, it says everything that we would want is what Senator Brandis wrote. The Bradley bill, which sounds like the one that's more likely to, at least they've done away with the 90 days, and they've done away with some of the other things, but they're still keeping limited the number of dispensaries that are available, which is keeping the variety down, etc. And then there's ones that, but one of the bills, which is what the Board of Medicine, the Department of Health tried to do, is made it that the Board of Medicine gets to decide whether your condition is eligible to receive treatment or not, and taking it out of the hands of the doctor, even though it specifically says in Amendment 2 that the physician's the one who ultimately gets to decide. And that would really set things back, because again, if I don't have to go to the state to argue for somebody getting Ritalin or for getting Risperdal or Prozac, why should I have to argue kind of case-by-case basis with this? And they're even allowed to, you place the order, and then they can come back and they have and they say up to 45 days or something to deny it after the fact. So you could actually start treatment, and then all of a sudden it's out. No, you can't. So that's the Rodriguez bill. If you want to write to somebody and yell at them, feel free to yell at Representative Rodriguez. Yes. Brandis is the one that is the one that so I do encourage you, and if you'll find it online, but if you can write letters, and if you're one who likes to write letters and to advocate for your cause, this is a really good one to make sure that the state is there. Now, into how many, one of the things that Brandis is saying that it shouldn't have to be the one person who plants the seed is the one who then packages it, who's the one that sells it. You may be a good grower, but you may be terrible at retail. Okay, I mean that happens. Okay, I mean I'm not good at retail, but I'm really good at telling a story. So that with the Brandis bill, that's like one of the things that goes against. So that's kind of where we are right now. I have about 10 minutes or so to answer some questions. I could talk a lot more in terms of lots of details on this. I could probably talk for several hours, and I can keep going if nobody has any questions. But does anybody have any particular questions about anything to start off with? Yes, sir. Okay. Recognizing that we do have a more conservative state than most of the states that have passed recreational, it actually, there's a couple parts to that answer. Because first of all, it depends on what's happening in this legislative session right now. Because by law, they have up to the, July to make to make any new laws, and then 3 more months to implement it. There's a battle going on right now, and they may not be able to pass anything to get to the governor's desk. Now, if that happens and there becomes this whole legal battle, I think you're going to see recreation on the ballot as a constitutional amendment within 4 years, because people are going to be really pissed at that point. So that's part of where that is, and there's actually people who are in the pro-cannabis movement. We're kind of hoping that will happen. Now, as a physician and seeing how that's going to hurt my patients, I can't advocate for that, but that's part of it. But most states who have passed similar types of laws have been 5 to 10 years before that's happened, okay? And I think before, obviously if it's a constitutional amendment, that's obviously different than what they're doing up in Tallahassee, and we know that the electorate is not isn't really being represented as much as what's up in Tallahassee, who are obviously beholden to lots of different corporations and things like that. So that's part of the question, okay? But the reality is that if this law does get implemented with a decent way of going about it, it probably is going to push recreational back, I think, because it's going to allow people to the main argument is going to be less, not for, again, I can get into a whole nother conversation and talk for another hour about why recreational. I won't do that now. But so I see that as potentially as being part of it. But, even the people who were thinking that it would be, obviously, I don't think that right now 71% of people in Florida would vote rec. We probably are at 50%, not enough to make a constitutional amendment, okay? But let's face it, if this law is able to be implemented and the people who were the naysayers recognize that the sky doesn't fall because of the fact that there's more cannabis in the state, more legal cannabis in the state, then that will be, then I think people will be more open to it. But, I'm focusing on how to help my patients right now. But do I think it's I think somewhere. But the reality is that, obviously what happens even up in Washington and being able to take this off of as a class 1 scheduled drug that's considered more dangerous than cocaine and with no medical use whatsoever, which is what the federal law says right now, which is why the credit card companies aren't taking it, which is why the researchers aren't allowed to do it, why people at Moffitt and the cancer centers aren't even allowed to become ordering doctors because they're afraid they're going to lose their federal funds for their clinical trials. That's big stuff. So that would be another great thing, is if we can get that the classification lowered. You had a question next, I'll take it next. Yeah.
What have you guys seen any studies on the medical side from like a place where, like Colorado, where it's obviously more legal?
The research is mostly coming out of Israel, and because of that issue, the researchers at universities who get federal funds for research, they're afraid they're going to lose their federal funds. So Washington State is actually just now getting a pain study. Probably be 5 years before that gets published. But I don't think that you're going to see major studies in America until they do declassification or lower the classification of the scheduling of the drug.
And what's within the studies from overseas? Like
very impressive. I mean, the first positive study on autism came out within the past couple months. I mean, pain. What we know about chemo. So I mean, it's amazing.
Negative.
No, that's the thing, and if we could have the federal government, lower the classification of it, that's going to just open up to everybody in a big way. There was a question, yes, and I'll take you next. So, yes, sir.
Who has the rights to grow once it passes for medical in Florida? Where is it coming from? And also,
Okay, that's a great question. And that's part of the good, the bad, and the ugly of it, because right now they can't. Because only 7 approved grows for the whole state of Florida has been allowed. That's part of the whole boys club thing that's happening right now, unfortunately. But that is keeping the pharmaceuticals out because there's no pharmaceutical that's been growing in the state of Florida for the last 30 years. And they're only going to start expanding the number of licenses to 8 to 9 to 10 for like every 100,000 more people who sign up. So I actually don't see Big Pharma getting their meaty hooks into this one because of the way they did that. I don't know if that's how the legislators planned it out that way, but I think from that perspective. But every single thing has to be grown in the state of Florida from beginning to end. I mean, there's even questions of like, how did they get the seeds into the state of Florida to begin with? Because technically that's not even legal as well, but they did. So yeah. Yes, please.
So I'm the lucky winner.
Uh-huh.
Rheumatoid arthritis.
Wonderful. Congratulations. That's
Yes, for abdominal neuralgia.
okay.
So I function because I'm on a cocktail of drugs every day of my life.
Uh-huh.
I live in Florida,
Mhm.
but I'm in Seattle 1 or 2 weeks a month.
Uh-huh.
So how does that work? If I am approved in Florida,
Mhm.
totally, licensed and everything,
Mhm.
how does one manage that if they're also in another state? Like, obviously Seattle is a non-issue. I
Yes,
can go from
right. So it's a gray area because so if you're talking about driving across the state, obviously there's no border control. No one's built a wall across the state of Florida yet. The um, who knows? Give us 90 days. You never know what'll be here. But but TSA is so when you go to the airport through security, that is federal. So that's a gray zone. If you're in the state of Florida going through a security zone, but it's TSA who's doing the monitoring, we don't really know about that, So now, because of the fact of the reality, because of the fact that there's not people with buds, which are going to be what would set off dogs, do I think that probably people will be don't ask, don't telling it? Probably. Obviously, I can't endorse that. But at the same time, if somebody had a kid with seizures and that was the only way that they don't want their kids to start having seizures on the airplane or when they get to where they are, people are going to do it. But then again, let's face it, people have been doing things for a long time just because they think it's the right thing for them. Yeah. But the state of Florida says that you have to be a resident of the state of Florida. Okay. So there does become the question, well, what is dual residency? What if I'm going to another state and I need my medicine if I can't bring it there? So there are those things, and again, if the federal laws were able to be changed, then that will be alleviating it. But there is still a lot of gray area with all of this stuff, So, I can tell people what the law is, I can tell people what I'm hearing people are doing, but the law is the law, And so, I certainly think that, that I think law enforcement was probably the happiest to see this bill pass. I was speaking with the sheriff a couple weeks ago. He's like, I've been on the job for 20 years, and for the number of domestic violence and other situations that I've gone to in 20 years, for all the alcohol, all the coke, the crack, the oxycontin, I have never in 20 years encouraged a single thing where I thought that there was an escalation because of marijuana. In fact, it's that if anything, they may say, hey, why don't you come over here, chill with me for a little while? That's more likely the situation, but they're not getting, those are not violent criminals. You're not a violent criminal if you're using cannabis. So, yeah. Yes, please, I'm thinking, yeah.
Have you noticed the same thing when it comes to mothers that may be on going through breastfeeding or anything like that, where it doesn't affect the child?
Good question. So, and actually, something I really didn't get much into, which I actually wanted to, was also understanding the CBD versus the THC, so the non-euphoric versus the euphoric strains. I will tell you that a number of amazing things that I have seen with CBD and no THC whatsoever, from seizure stopping to muscle tremors to anxiety, it is pretty impressive. So, and so in my practice, granted, if I have a vet who comes to me and says, hey, I've been with PTSD for 40 years since I left Vietnam, and I've been using this stuff daily, I just would like to have a card so I don't get in trouble, my answer to them is thank you for your service and have a nice day, and here you go. I have a 70-year-old woman with Parkinson's who's never even drank a glass of wine, let alone tried cannabis before, and I'm taking that person much slower. I'm introducing CBD first, getting them up to good doses, and then bringing in the THC. But one of the nice things is that THC, the euphoric effects of THC, actually seems to be blunted by CBD. So you can actually give a person THC when they have CBD in their system, and they won't get the high, or much less high, so that they can have much more of a function. So that's one of the things. So would I have any concerns about a mom taking CBD during nursing? No. There are no studies about that, but from everything that I'm understanding about this, there's not really a concern. Now, it is a fat-soluble substance, so it probably is going to accumulate in breast milk. Would I have concerns about a breastfeeding mother passing it along to their baby? I do. Okay. Now, you will, I think that you, and probably, God willing, Dr. Hale is studying this right now. There's a wonderful book called Medications in Mother's Milk, if you've ever seen it. Every single drug and herb, almost everyone except for this guy tested how much of the medication is in the mother's bloodstream, is in the milk, and is in the baby's bloodstream for every single dose that a person can take, where he was able to find that the only drugs that were absolutely contraindicated were chemotherapy drugs and lithium. Yeah, and so there's really any drug that's out there you can do safely on breastfeeding when you weigh the pros versus the cons. So, but I mean, again, it still comes back to the pros versus the cons question. Does the benefit to the mother and child outweigh the benefits? If a mother was having significant postpartum depression and nothing else was worrying, and we were talking about potentially being on suicide watch, but she realizes that still the best thing for my baby is to breastfeed. You have to weigh the pros and the cons, but that's a serious conversation that I have to have with them. And then we also, but then you can also talk about microdosing. 10 to 15 milligrams is going to get most people high. Can you then give 1 or 2 milligrams every few hours, and maybe just to take that edge off to get them through, but not to the. Let's face it, I do it kind of like with wine. If you're tipsy from drinking it, probably your baby will be. If you're using it in small amounts, then probably not. Anyways, I do need to wrap up. They're waving at me and throwing things at me, so I don't want to do anything. But anyways, I will be happy to step outside and to continue to answer anybody's questions. But thank you very much for coming, and enjoy the rest of the expo.